I'm proud that in Colorado we've already had 11 hearings in our state to talk about how to set up the exchanges. And in fact, just this week or last week, the House Majority Leader in the state of Colorado, who's a Republican, and a Democratic state senator are pairing up to work on a bipartisan piece of legislation to begin to implement the exchange. So we care deeply about it. I had an article yesterday in the Denver Post where a Republican legislator in our state said, quote, "Most people viewed exchanges as the most free market part of Obamacare," as she referred to it. I'd call it health care reform. But so this part of the puzzle is getting a lot of high praise in our state. And I wonder, Mr. Larson, first of all, whether that's an apt characterization. Is this a free market approach on the exchanges? And you have a lot of experience both in the private and public sector when it comes to health care reform. I wonder if you'd talk a little bit about the free market qualities of this and also the balance that needs to be struck between making sure we've got common sense regulation and a free market on the other hand.
Well, I agree. I think it is very much a free market approach. Certainly, the exchanges rely on the participation of the private insurers and co-ops if they get set up in those states. So it is very much reliant on setting up a marketplace. And one of the big advantages of the exchanges is the one-stop shopping transparency component. I mean, that's how a marketplace works, when you know what your options are and you can evaluate options and differences between options, and that's at the core of what the exchange is.
So if you were in a town hall in my state and somebody were asking you, Mr. Larson, what would this look like in 2014 if we had a fully functioning exchange versus what would it look like if we didn't have an exchange? To me, I've got 3 little kids at home, and if I were a small business owner or somebody employed by a smaller business, what difference does all this make to me?
Well, I guess I would compare it to, in so many other areas today, technology and the internet has allowed us to have more accessible, understandable choices, whether it's buying airplane tickets or trading stock. And that technology and those choices have not expanded to the health insurance market. So with an exchange, you can go to one place, one site, enter basic information and get an array of choices, learn more about the plans, enroll, determine where you're eligible. That's what the future is. That's what the exchanges are going to do in 2014.
And what effect can that transparency have on cost, do you think?
Well, I think that's one of the challenges today, that there is no real price transparency. It's very difficult. You can look at one plan and you know what one plan is. So when insurers know that they're going to have to stack their prices up against other plans in the marketplace, I think everyone would agree that that can have a leveling effect and require plans to become more efficient. If they want to sell, they're going to have to compete on price and on quality, which is going to be another component of the exchanges.
As the states begin to set up the functioning exchanges, if more than one state wanted to get together and provide an exchange together, would they be able to do that?
Yes, and our goal is and will be always to give the states the maximum flexibility. So there may be regions of the country where a regional exchange makes sense, and if they can get together to do that, they should do that.
So in those instances where the regions, the states themselves would decide, not the federal government, but the states would decide to come together, that in those instances you could have a marketplace that extended across state lines for insurance.
That's right.
And that's the purpose of the law, right, in many
That's
respects. I wanted to also piggyback on the chairman's question earlier, and maybe this is a little bit away from exchanges, but based on your experience as insurance commissioner and insurers, you know, I continue to hear from the small businesses in my state that they are just being crushed by rising healthcare costs. And I wonder, while we have you here, whether you'd be willing to give us the benefit of your acquired wisdom about what we could do and what you are already trying to do to bring these costs back in line, because it is strangling our ability to create jobs and keep our doors open.
It's a challenge today. It's been a challenge really for the last 20 years. I think the premiums for small businesses have been a challenge for a long time. One of the things the exchanges do is they reduce the administrative costs significantly. We know, and I think the chairman pointed this out, that if you look at the administrative costs for large groups versus small groups versus individual groups, it's low and it goes up higher with each inversely proportional to the size. So exchanges at a minimum help to lower the administrative costs associated with selling to small businesses. The ACA generally has a number of provisions that are going to be kicking in, but will take time and it should be fully functional by 2014, that help reduce costs, including, patient safety initiatives and getting more people in the insurance pool. The MLR standard that we talked about incentivizes health plans to be more efficient and to spend more on quality, which actually reduces costs for their policyholders. So there's a number of provisions that are in play, but will take some time to get there until 2014.